Joining me now is Dr. Lee Riley. He's a professor and chair of the Division of Infectious Disease and Vaccinology at the University of California School of Public Health in Berkeley. Thanks so much for joining us. The U.S. inoculation efforts have kind of hit a wall of late. In China, they're accelerating the pace of inoculations. Talk to us about China's efforts inside its borders, but as well as its distributing vaccines around the world. We were just talking about Egypt and South Africa. Those are just two countries where we're seeing that. It's happening in a lot of areas.
Yeah, so China has really accelerated its vaccination campaign. I understand that they can now vaccinate up to about 20 million people each day, and so. But I guess the large population of China is going to still make a real challenge to vaccinate enough people that they can really slow down the transmission. Both the Sinovac and the Sinopharm vaccines require 2 doses. And so to give 2 doses to 1.4 billion people is going to still require a lot of effort, but they're really making a major effort to achieve some level of herd immunity.
Yeah, and Dr. Riley, you make a really good point. I mean, you got a lot of people you got to vaccinate, but can you talk about some of the other challenges China is facing with COVID? Because we're seeing an outbreak in a city bordering Myanmar, but in April of 2020, there was an outbreak in a Chinese city on the Russian border in May of 2020. Another small outbreak at a border town near the DPRK. China is unique because it borders 14 countries, and this is a global pandemic. So even if you're doing a great job within your own borders, you're at the mercy of a virus that doesn't recognize borders, right?
Exactly. And so it's not just the bordering regions of China. You know, you had an outbreak of Delta variant in Guangzhou just last month. And so, you know, the virus doesn't obey any sort of borders, whether it's land borders or air borders or any of these borders.
What about travel restrictions? Do you see any likelihood that that might be eased anytime soon?
It's certainly possible. You know, as I said, still a large proportion of the Chinese population is still unvaccinated, and so they still have to be somewhat vigilant about travel restrictions.
Yeah, and a third Chinese vaccine, CanSino, is under review by the World Health Organization. And in Europe, health officials are evaluating China's Coronavac for possible use in Europe. Obviously, more vaccines out there in the arsenal is a good thing. Talk to us about the overall campaign. How do you see things right now?
Yeah, any new vaccine would be helpful for the vaccination campaign. This new vaccine by CanSino is an adenovirus vectored vaccine, which is similar to the Johnson & Johnson vaccine. So it should have similar level of efficacy, and so they can get that out as quickly as possible. That would definitely help the efforts to bring down the transmissions.
We heard the British Prime Minister the other day talking about herd immunity. It's those two words get bandied about quite a bit. How far away are we from herd immunity? I mean, it seems like it's quite a distance as you talk about how many people still need to be inoculated.
Right. It's a good question. You know, early on, people were talking about herd immunity as though those are really achievable goals, but you know, there's probably no such thing as herd immunity that a single country can achieve. As you know, this virus doesn't obey borders, as we just mentioned, and so it's just not going to be possible for any single country to attain a true herd immunity. China can reduce the levels of transmission more than where it's at now, with maybe 80 to 90% of the population vaccinated, but that's not going to really contribute to true herd immunity. True herd immunity means that the whole world has to be vaccinated.
It's going to be a long haul, isn't it?
Right.
Dr. Lee Riley joining us from Northern California. Thanks so much.